Hello, and welcome to the Focus on Eye Health Expert Series. I'm Kira Baldonado, Vice President of Public Health and Policy at Prevent Blindness. Joining me today is Dr. Lauren Ditta, pediatric neuro-ophthalmologist at Le Bonheur Children's Hospital, and Associate Professor of Ophthalmology and Pediatrics at the Hamilton Eye Institute at the University of Tennessee Health Science Center. Welcome, Dr. Ditta.
Thank you, Kira. I'm happy to be here.
I know that nearsightedness or myopia is talked about a lot now. There's a dramatic rise in that across the globe. And we talk a lot about myopia, but what's not talked about a lot are those lifelong considerations for children with high myopia. So talk to our audience a little bit about what are those considerations and why should we really be paying attention to myopia now at its treatable stage?
Sure. I think the myopia epidemic really came to a head during the pandemic. And many parents and many ophthalmologists became concerned about this virtual learning when so much of the education was right in front of the child sitting on a computer all day. And so what that does is when we're looking at things up close, our eyes are in a constant state of over focus, or what we call accommodation. And so when the eyes are trained to be set like that, what happens is over time the eyes just want to be naturally in that position, and so it can create nearsightedness. Nearsightedness is a term that means you can see up close, but it's blurry or difficult for you to see at distance. And so patients need glasses to see. And the more that you stress the eyes and try to over focus, will create more and more nearsightedness over time. And so it is a challenging thing when talking about conditions that may be present now, but then may progress over time, and treating it now, because it's hard to know, well, I'll wait to do it next time, or maybe at the next visit we'll address it, but it is a progressive thing. And our society now, with all of the technology being so up close in our faces on the phones, we're really just in a constant state of over focus and over accommodation. And so over the last couple of years, there's really been a lot of studies that have been going on for some time, but more discussions about ways to kind of halt this over focusing, this myopic progression. There are drops that can be used in the eye. And so we want to slow down that myopic progression, because later on in life, the more nearsighted you are, it can cause the eye to behave differently. It puts patients at risk not only to be completely dependent on glasses or contacts to see, which in and of itself is a very big risk for patients who maybe don't have the ability to get glasses or contacts on a frequent basis. That's actually quite a big issue. But the other thing is it puts patients at risk for retinal detachments, retinal holes and tears. And if the eye is struck at any point, any type of trauma, the eye can be more sensitive to damage. So really, we want to create these situations where patients, if we're not treating myopia directly, we at least educate parents and patients to say, if you're using devices and looking at things up close, you want to take breaks, give those eyes a period of rest where you're doing something, you're outside, you're looking at a distance, so that over focusing isn't in a constant state all the time.
Thank you, Dr. Ditta, for being
You're
here
welcome.
today and for all that you do to keep vision healthy. For more information about the topics that we discussed today, go to preventblindness.org, and we'll see you next time.
Thank you.